Hi, and welcome to the show. Rate and review at kevinmd.com/rate. Subscribe at kevinmd.com/podcast. Today, we welcome back on the show Althea Halchuck. She's a patient advocate. Her Kevin MD article is titled, "What's the Sense of Having a Living Will If It's Not Honored?" Althea, welcome back to the show.
Thank you, Kevin. It's great to be here.
So we'll get into your article in a little bit. But for those who didn't listen to our first episode together, just briefly share your story and journey to where you are today.
Okay. I'm a patient advocate, a certified patient advocate. I started Ending Well Patient Advocacy in order to help people experience a peaceful death, a good death, the death they want. And in that journey, I got a law degree. I'm a certified thanatologist, so I can educate people about end-of-life topics. And I have a contract with the Final Exit Network as their surrogate consultant. And they developed a program for people that are the surrogates, proxies, healthcare power of attorneys for other people. And if they're in a setting, like a medical setting, and they get some kind of pushback about any kind of treatment, and they don't think that's right, they can call me and I can review the paperwork, tell them what their options are. I don't give medical advice or even legal advice, but really I just point out, the road they can take and maybe what kind of conversation they can have to empower them to have the conversation with the medical provider. And that's how I ended up with this topic. The surrogate consultant service, I get a lot of calls from people. Mostly they're surrogates for a loved one, and they either the person has got dementia or in a long-term care facility and they're incapacitated, and now the surrogate has to make some medical decisions, and they're trying to go by the roadmap of the advanced directive, but they're getting some kind of pushback. And so that kind of led me to the latest type of medical malpractice case, which is the wrongful prolongation of life. And that's really what the topic is for my article, my latest article for you. It's keeping people alive against their will, basically.
So let's go straight into your article and talk about the case that kicked it off and tell us about a little bit of the background of that.
Okay, well, there was a dentist in New York, New Rochelle, New York, and he was diagnosed with early onset dementia. He was only in his 50s in 2011, and he immediately drafted his advance directive with a provision that he did not want to be kept alive if it came to where he couldn't recognize anybody. That was the point where he said, just comfort care. I don't want intravenous fluids. I don't want antibiotics. I don't want any kind of, quote, treatment, because it's not going to do me any good. I'd rather just go peacefully. But he was in a long-term care facility and he fell. Somehow he ended up out of the bed. He didn't recognize his wife, who was the healthcare power of attorney, or his two children, adult children. And they bring him to the hospital where the wife, the children, he had a MOLST, by the way, POLST, whatever state you're in, it's the medical order for life-sustaining treatment. And it said comfort care only, nothing else. Well, a doctor in the emergency room, I'm guessing, knew all this because she said to him, she talked to the doctor, the wife did, and so did the sons, and they provided the POLST, the advance directive, everything. And he proceeded to give Dr. Greenberg, he gave him antibiotics because he had a bad infection. And so he got antibiotics, he had a CT scan, he got intravenous fluids. He had all these things that he didn't want. So the antibiotics kept him alive an extra month. And his wife and children had to, be a witness to that, to his suffering. So they sued. And these type of cases normally for many years were thrown out of court. the doctor, provider, facility, you name it, had some kind of blanket immunity where whatever they did was okay. They kept somebody alive, so how could that be wrong? And because of that, lawyers did want to take cases, but there was a case in Georgia. A young girl was her grandmother's surrogate, and the grandmother didn't want to be intubated. She didn't want to be on any kind of life support. The granddaughter was in her 20s. She was young, but she was really a great surrogate. And she told everybody this. The grandmother told her friends, everybody, her healthcare providers. Well, lo and behold, they intubated her, they put her on a ventilator, they kept her alive, and the granddaughter sued. And what happens is the lawsuit happens in 2013, 14, whatever it is, but it takes so long to go through the courts with all the appeals. It doesn't, one appeal after another, it keeps getting thrown out of court. And then finally, a Supreme Court in Georgia took a look at it and said, no, this is wrong. She has a right to say no to treatment, even if it's life-saving treatment. And it's her decision, it's her surrogate's decision that rules here, not a provider who thinks they know best. So they settled that case for $1 million. And that was one of the biggest and first huge settlements. And because of that, the floodgates are open. People have the right to make their own healthcare decisions. The Patient Self-Determination Act from 1990 says that. You have that right. And just because a provider doesn't agree with it doesn't mean it's wrong. So that's kind of where the trend is. And I will say the Greenberg case hasn't settled yet, but I know it's going to. I just feel it because they don't want these cases to get before a jury because they're so emotional. And I mean, how can you not feel for a wife who told them not to do anything and they did everything? It's heartbreaking. And then in some of the cases, they have to, like the granddaughter had to take her grandmother off life support. So this was something the grandmother didn't want. And now she comes along and she has to say, okay, let's wean her from the ventilator. And I mean, that's just so emotional and so heart-wrenching, and she's never going to forget it. I mean, it affected her whole life. So $1 million sounds like a lot of money, but in the long run, I think she'd rather have not had to go through this whole process.
Now, in a majority of the cases, and you could talk about the Greenberg case, but in your opinion, why do medical institutions and clinicians, why do they sometimes continue treatment despite these advanced directive orders?
People that have done studies about this, I think it's more of sometimes a communication problem, like somebody comes into the emergency room and this doctor's never seen this patient before, and instead of asking what's the code status, he just immediately goes into CPR. That's it, we're gonna keep them alive. So that's one problem. Another problem is when they have the advanced directive in their hand and there's a miscommunication or they don't follow policy or protocol. I mean, really, it goes right back to education. And I think if somebody came into the emergency room, the first questions should be, what is the code status from whoever brought them in, a family member, the surrogate, if there is one. A lot of times there isn't, and so they have to default to save the life. But these are not those cases. These cases, people had a clearly defined advanced directive, what they wanted, and sometimes it's ego. The doctors are trained to keep people alive. They're not trained to let them die. And I think you see a lot more in palliative care where those doctors, they accept it when a patient says, you know, I'm done. I don't want any more chemo. I don't want any more of this. Just let me go comfortably. But, you know, in an emergent situation, that can't always happen if they don't have access to the documents, which is another issue. So it can be many reasons, but the cases that I've studied, it's really people, providers. In one case in California, it was the social systems. These people took the right away from a guy's, I think it was his mother. She was his healthcare proxy, and they stripped her of that, and they made decisions for this guy. Well, they sign fraudulent documents. I mean, why would anybody do that? It's just beyond belief. And those people, it was a crime, so they have to face criminal penalties. But other cases, it's just a matter of, no matter how much the surrogate says, no, don't do that, the doctors just either try to placate them or talk them into something else. And this is why my work with Final Exit, you know, I'm a mediator basically, and that's what I do, is try to bring the parties together to some kind of resolution. But often in these cases, if it clearly says don't do it and the doctor wants to do it, how can you, I mean, it's really kind of letting the doctor know this is unacceptable, and we really need to follow the directive and what the patient wants.
Do you have a sense of how wide this scope is? Are there any studies? Is there any data that can articulate how often this happens?
I don't think there's a lot of studies about it because it's so new. These cases just started appearing in, like, you know, in the settlements, like in 2015, 2016. And in the course of legal history, that's really a short period of time. But it's almost like, you know, once it isn't even doctors that once they hear about it, once the legal team hears about it, once the insurance company hears about it, and once the CEO of a hospital hears about it, they have to really train the staff to say, you can't go against the advance directive. That's it. The advance directive is the Bible. You cannot go against it. So I can't say, but every one of the cases, and I've done a lot of presentations on this, every case that I present, they're from all over the country. It isn't one region or another. It isn't one political party or another. It's so egregious that they're happening all over the country. And I think a lot of lawyers now, plaintiff lawyers, are saying, well, you know what? We can fight this and we can win. But it takes a lot of money and a lot of time. And the lawyer in Georgia, when they settled that case, he said, we wanted to shout it from the rooftops because they were wrong. They admitted, they probably didn't admit they were wrong, but they paid $1 million. So that tells you enough, that what you need to know. And more happening. And that's why I said that about the Greenberg case, because they just hit their last appeal, the defendants. And so once that happens, now it's going to go forward to a jury trial. And that's when settlements start happening. Because like I said, it's so emotional. You don't want to have these cases in front of a jury. You think $1 million is a lot of money. Let it go to a jury and see how much they give this family.
Now tell us your ideal world. What can patients, families, clinicians, hospitals, in your ideal world, what can they do to reduce incidences of these cases?
In my ideal world, everybody has an advance directive, but really only 30% of people in the United States have one. In my ideal world, the advance directive is the first thing people look for in the emergency room, or a person that can speak for the patient. It's really more important to pick a good surrogate. So that's my ideal. Whether or not they have an advance directive, if the surrogate knows the patient well enough, they can speak for that patient. And so choosing well, and not just your husband because he's the next closest person, but choose somebody that's going to go to bat for you, that's going to fight for you for what you want. And not everybody wants nothing. There's so many people that say, yeah, do everything. Like, spend all the money in the world to keep me alive, till my last breath. But most of the time, I think people, they want to die at home. That's another thing I'd love for people to have. They should be in hospice and palliative care a lot sooner than they are. Hospice is like 6 months, and the average is like 17 days. That my ideal world, people would be referred to hospice a lot sooner. They would accept the diagnosis and really kind of wrap up their life and have a more peaceful death. That's kind of it.
And my final question, tell us some of your take-home messages that you want to leave with the Kevin of the audience.
Everything I just said, refer to hospice and palliative care sooner, educate the medical staff on who's right. It's the patient. It's the patient's rights that are important, not the doctor's ego or keeping someone alive. Giving CPR to a 95-year-old woman, is that really the right course when you could break, her ribs and her sternum, and she probably will have no quality of life? That's the thing. Like, I think people have to use more common sense when it comes to end of life treatment. And that would be my message. Be sensible. Like, if this were your mother on the table, would you give her CPR? Would you want to give her chemo? And that's happening. Most of the money spent in Medicare is in the last like 6 months of life. Why? That's just crazy. So,
Althea, thank you so much again for sharing your time and insight. Thanks again for being on the show.
all right, Kevin, thank you.